Have you ever had a toothache headache and wondered which one started first? That's exactly why this topic matters. Sometimes the pain begins in a tooth and spreads upward into your head. Other times, a headache problem can trick you into thinking one tooth is the real issue. So who gets confused most often? People with throbbing tooth pain, pressure in the face, pain near the temples, or that weird feeling where one side of the head and one side of the mouth seem connected. What makes it so frustrating is that the pain can feel sharp, deep, pulsing, or constant. When does it usually hit? Late at night, during meals, after poor sleep, or right when stress has been building all day. Where does it show up? In the tooth, jaw, cheek, temple, eye area, or even the neck. Why can one pain spread into another? Because the face, teeth, jaw, and head share nerve pathways that can blur the source. And how do you stop guessing? Stay with me, because by the end of this video, you'll know the clues that help you tell the difference. And when it's time to get help. Let's start with the basic question. What is a toothache headache? It's not a formal diagnosis. It's the experience of having tooth pain and head pain that seem connected. Why can that happen? One common reason is a dental problem like deep decay, a cracked tooth, gum infection, or an abscess irritating the nerve-rich tissues in and around the tooth. Another reason is pressure outside the tooth like sinus inflammation, especially if the upper back teeth hurt. Who is more likely to notice this? People with untreated cavities, old dental work, sensitive teeth, gum swelling, stress-related clenching, or recurring sinus pressure. When do symptoms often get worse? During eating, when drinking something hot or cold, late at night, or when bending forward with sinus pressure. Where is the pain usually felt? In one tooth, the gums, cheek, jaw, forehead, or temple. How does the body make this feel so confusing? Because nearby structures can refer pain, meaning the brain may not always identify the exact source perfectly. That's why one painful tooth can seem like a headache, and one headache can feel strangely dental. So how do you know when the tooth is probably the main problem? Start by asking 6 simple questions. Who notices it most? Usually someone with a very specific painful tooth, gum tenderness, or sensitivity to temperature. What does it feel like? Often sharp, deep, throbbing, or pressure-like, especially when chewing or biting down. When is it worse? During meals, after sweets, with hot coffee, cold drinks, or late at night when everything feels louder. Where is the pain strongest? Commonly in one tooth or one side of the mouth, then spreading into the cheek, jaw, temple, or side of the head. Why does that happen? Because irritation inside the tooth or around the root can trigger surrounding nerves and tissues. And how can you spot an infection warning? Watch for swelling, a bad taste in the mouth, fever, facial puffiness, trouble opening the mouth, or pain that keeps getting stronger. Those clues matter because a simple sensitivity issue is one thing, but an abscess is another. If the tooth seems to point to one exact spot and touching or biting makes it worse, don't ignore it. Now, here's the twist a lot of people miss. Sometimes the pain feels dental, but the tooth is not the true cause. Who gets caught by this? People with migraine like pain, sinus pressure, facial nerve pain, or stress-related clenching who assume one tooth must be the problem. What does that confusion look like? Upper tooth pain with facial pressure during sinus inflammation, or facial pain during a headache disorder that seems to sit right in the teeth. When should you suspect this? When your dental exam is normal, multiple teeth seem to hurt for no clear reason, or the pain comes with light sensitivity, nausea, facial pressure, or a strong headache pattern. Where does it usually show up? Often in the upper teeth, cheeks, around the eyes, forehead, or temples. Why does it happen? Because the head, face, teeth, and sinuses share closely connected nerve signals, so the brain can misread where the pain started. How do you protect yourself from guessing wrong? Look at the whole pattern. Not just the tooth. If the pain changes with sinus symptoms, headache triggers, or visual sensitivity, the story may be bigger than the tooth alone. Let's talk about the triggers that quietly connect toothache headache symptoms. Who is most at risk? People who grind their teeth at night, clench during stress, skip dental checkups, or push through pain until it becomes a daily pattern. What are the hidden triggers? Bruxism, untreated cavities, A cracked filling, gum infection, wisdom tooth pressure, sinus flare-ups, and even poor sleep. When do these usually hit hardest? In the morning after overnight grinding, during stressful workdays, or after chewing on one side because another tooth already hurts. Where does that tension build? In the teeth, jaw muscles, temples, cheeks, and sometimes the neck. Why is this important? Because if you only treat the headache but ignore the dental or jaw trigger, the pain may keep cycling back. And how do you notice the pattern? Ask yourself, do I wake up with a tired jaw, flattening of the teeth, facial soreness, or a headache that feels like I slept with tension all night? That question alone helps many people connect dots they've been missing for months. Sometimes the trigger isn't dramatic, it's repetitive, quiet, and happening every single day. So what should you do if you think your toothache headache is not random? First, don't just guess forever. Who should book an appointment? Anyone with persistent tooth pain, repeated one-sided facial pain, swelling, fever, chewing pain, or headaches that keep coming back with mouth symptoms. What can help while you're waiting for proper care? Keep food soft if chewing hurts. Avoid chewing on the painful side. Pay attention to hot and cold triggers and notice whether stress or sleep problems are making things worse. When should you move fast? If the pain is escalating, sleep is affected, swelling appears, or the mouth is harder to open, where should you go? Usually a dentist first for tooth and gum causes, though a doctor may be needed if the pattern points more toward headache, sinus, or another medical issue. Why is timing important? Because an untreated abscess will not fix itself, and repeated pain cycles can become harder to sort out. How do you help the appointment go better? Track when the pain starts, what triggers it, exactly where it hurts, and whether chewing, bending forward, or bright light changes the pain. Before we end, let's make the message simple. If you've been dealing with toothache headache, the biggest lesson is this. Don't ignore the pattern, and don't assume every pain starts in the same place. Who should remember this most? Anyone with repeating tooth pain, one-sided facial pain, swelling, morning jaw tension, sinus pressure, or headaches that seem linked to the mouth. What should you do next? Notice the trigger, location, timing, and anything that makes it worse. Then get checked if the symptoms persist. When should you seek urgent help? If you get a sudden severe headache, confusion, fainting, weakness, trouble speaking, vision changes, high fever, or a severe headache after a serious head injury, where does real improvement begin? With the right diagnosis, not endless guessing. Why does that matter? Because treating the true source can save time, money, and a lot of unnecessary suffering. How do you move forward? One smart step at a time. And here's my final reminder. This video is for education only and is not a substitute for personal medical advice, diagnosis, or treatment. If you found this helpful, please subscribe and leave a comment or suggestion for the next video topic.